My name is Marlita White, and I manage the Office of Violence Prevention at the Chicago Department of Public Health. And I am going to talk about our three CDBG funded programs. And I will announce them now, but then I'll talk about them in more depth. The Violence Prevention, Bullying Prevention Program, Violence Prevention, Restorative Practices, and mental health services and prevention education for childhood sexual assault victimization. Um, as Patrick mentioned a little bit, the Healthy Chicago 2025 policy agenda is a really important and key strategy document for all of our programs here at Cdph. Our portfolio of violence prevention programs really focus on reducing the likelihood of violence-related injury and death, and also to support traumatic recovery and healing across Chicago communities. Our violence prevention programs focus on teaching violence prevention strategies, through community education workshops and professional development, other kinds of trainings. We also really focus on strengthening community systems and as well as leveraging citywide systems, working at the national level, the state level, certainly across the city, and also at hyperlocal um, levels and within regions through using the kind of resident capacity of community groups, all applying violence prevention lenses to the work that they're doing and really trying to reach and empower community partners to strengthen services and interventions. With our focus on violence prevention, CDPH then collaborates with community partners and delegates to provide services to vulnerable groups that align with the broader CDPH 2025 policy agenda, again, which is our 5-year health improvement plan. The department's vision is that Chicago would be a city where all people and communities have power, are free from oppression, and are strengthened by equitable access to resources, environments, and opportunities that promote optimal health and well-being. We do mention in the RFPs that you all will be reviewing that our program should align with CDPH's principles. And so as an applicant, you should be able to think about how your organization currently works across these principles, as well as your commitment to increasing or um, strengthening your focus on at least these four principles: deconstructing racist systems, trauma prevention and trauma-informed services, cultural responsiveness, and health equity in all communities. So you will see that more as you're looking at our RFPs, but again, those are principles that we really want to weave across all of our programming, and so we are looking for partners who are able to articulate that in their applications and through their programming infrastructure. So let's talk first about our CDBG bullying prevention program. This program focuses on the selection of one applicant. The anticipated award is $100,000. This program seeks to fund a delegate to implement our bullying prevention program, which aligns with several strategies, calling for improved interventions in the bullying prevention space, enhancing access to support. So thinking about how individuals who may be being confronted with bullying behaviors, even individuals who themselves may find themselves being hostile or aggressive with other people, where they might be the person carrying out certain kinds of bullying activities. Really, how do we increase access to those resources across the Chicago landscape? And how do we improve community, public, and provider awareness of interventions that make a difference? So, for example, we know that within our programs, oftentimes some of the programs in the city or state or county may have really good models at play, but if you don't know about those models, you don't know about those programs, you simply don't know that anything is happening. And so we're looking for a bullying prevention partner who is going to help to raise the profile of those kinds of interventions that are evidence-based and that are adaptable to a Chicago or an urban setting. This program will offer evidence-based bullying prevention education and pilot services to community-facing providers, community leaders, and residents to reduce the incidence of bullying that impact youth and adults. So again, you may notice that we talk about youth and adults. Oftentimes people focus on bullying and they cut off the interventions at the age of, youth or childhood, so maybe going up to 18. Our programs specifically want to be able to wrap into our community education the ways that adults as well are confronted with um, bullying activities and the kinds of interventions that are really adaptable and adapted for adults as well. This program will also strengthen through cross-training and convening the Chicago Collaborative of Bullying and Suicide Prevention. This is a group of professional, government, community, and subject matter expert stakeholders who will work together to guide the prevention and promotion activities of this initiative. You will notice, and people who may have been familiar with the program in the past, that this initiative uh, both reaches bullying prevention as well as suicide prevention. We have for 2025 reduced the focus for the provider to be able to demonstrate their past experience in bullying prevention, but they will be working with Cdph's suicide prevention program within our mental health division. They will also help to co-convene citywide partners. And so that means working with organizations that serve Chicago and serve Chicago communities because they have either a focus on bullying or suicide prevention. Again, this program is focused on identifying and promoting best practices, coordinating existing programs to increase bullying prevention across Chicago and increase the response. Also to increase proven interventions and capacity building supports that are available to residents and communities that are vulnerable to bullying and suicide pressures. I will talk just a little bit about the activities that this organization, if selected, would be expected to carry out. You would, for example, identify and convene and engage relevant Chicago serving providers and stakeholders to engage in the collaborative we just talked through as a rallying point for planning and service coordination, capacity building, and training and collaborations that reduce bullying and suicide risk factors. You would be involved in ensuring the involvement of youth, family, and other underrepresented community voices as we talk about and elevate bullying and suicide prevention programs across the city. We know that certain groups are not frequently involved. So of course we call out youth, of course we call out families, but as the partners prepare your applications, you should also look across data around risk so that you're able to speak about other voices that are underrepresented. We would be expecting the applicant to maximize the use and sharing of key data that help the Chicago audience understand the risk around bullying and suicide and the opportunities, therefore, of increasing prevention activities. To identify, adapt, and maximize the use of evidence-based materials and curricula and interventions so that we are doing more of what works and less of what does not work or what has not been determined to be effective. The goal also is to expose residents and providers to these interventions so that there's more of an opportunity across Chicago communities and that even including those mental health services that victims oftentimes will require and need to engage in to ensure that they are, as we said, um, recovering and healing from potentially traumatizing experiences in their past. We want to make sure that people know how to find those services and that they don't have such a hard time reaching out for supports. And I'll talk about our uh, eligibility, and this is going to hold across all three of our programs, that these services, in terms of the applicant, you should be a nonprofit organization serving in the across the state, of course, but be a nonprofit organization with a 501c3 status. You should have an office located in the city of Chicago where you're offering services. So not just a mailbox, but you're providing some service in Chicago. You should be in good standing with the city of Chicago. So consider your debts and things of that nature. And then also you should be able to demonstrate in your application that you have the administrative, organizational, programmatic, information technology, and fiscal capacity to plan, develop, implement, and evaluate the proposed project. So that means that you have the staff that can organize and manage the payment and the billing that comes along with a city award, that you have the infrastructure within your organization to provide those kinds of special services in terms of initiating that application, carrying out and executing a contract, managing staff for if funded, the particular program, and managing all of the audits and all of the other responsibilities that as an organization you need to conduct to keep your business operating in good standing, that you have the programmatic experience and expertise so that your staff, as you're applying, you're able to talk about how your staff are well fit for these kinds of activities and expectations, that you're able to, from a technological perspective, to engage with the city and our team to manage your awards. So thinking, do you have steady access to the internet? They're pretty low barrier, but we don't take for granted that all organizations do have that capacity. So we do raise that because that would constitute a real barrier for you being able to routinely manage and interact with our team. So that is something that you should be able to identify and confirm. And then as well, the fiscal capacity, so that you, in terms of your cash flow, the city does operate and our programs operate on a reimbursement basis. And so you should be able to manage your program and your cash flow until your vouchers begin to be processed, and then moving forward from there, handle the month-to-month vouchering and then payments cycles. Let's talk about the restorative practice grant. Restorative practices, this is an award that has two expected awardees, and it is at $200,000 per award. Our restorative practice program promotes pro-social conflict resolution. We emphasize positive relationships over a win-lose approach that can focus on escalating conflicts if you're talking about a win-lose approach, and increase the risk of violent injury. So our restorative practice, or RP programs as we call them, they really center on locating these services in communities across the city to provide communities with consistent access to pro-social restorative resolutions where the positive relationship between the persons that are involved in the conflict are really the priority. So we want to move away from winning an argument, losing in a conflict, to really saying we have prioritized and restored the relationship that may have been injured and or violated, hence the conflict. This program aims to expand the restorative practice opportunities that are within our targeted communities, but we know that we exist and map over a broader infrastructure of restorative practices that happen across the city and across the county and broadly beyond there. This program identifies two clusters of geographic space that applicants should consider upon applying. To the west side of the city, this program prioritizes East Garfield Park, West Garfield Park, Austin, North and South Lawndale. And so that means as an applicant, you would consider that you would like to apply to be the restorative practice awardee, and that those community areas would be the spaces in which you would identify, stand up, and actually offer your restorative practice resources. And then for the provider who's selecting to the south side of the city, that would be the East and West Inglewood community, Roseland, Auburn Gresham, and Chatham. By funding restorative practices in these communities, CDPH aims to strengthen partnerships with other city-funded and community-based initiatives, improving care, continuity, and enhancing provider capacity to deliver restorative interventions. As an applicant, you may apply, as I mentioned, to serve to the west or the south. You should not apply to provide services in both in a single application. Our applications will be reviewed in that particular way. So, for example, if you submit one application saying you want to do both, that would take your application out of consideration. So you should only apply to serve in one application, serve to the west. And if you elect to submit a second application indicating your interest in serving to the south. The restorative practice framework includes a set of emerging strategies that hold great promise for promoting community healing and setting the stage for the development of safer, healthier, and more resilient communities. Some of those healing strategies include restorative justice programs that shift the norms toward conflict resolution, where we're resolving conflicts and not, for example, resorting to only calling the police, which might indicate that the conflict has truly escalated beyond the point of kind of calmly or peacefully reaching a resolution. Encouraging restorative policing, for example, where officers might be trained to engage the community through restorative practice. We want to look across all of our systems and really think about how we can encourage and embed restorative practice training so that that strategy is an opportunity and an alternate strategy that any of our systems partners can utilize as we're engaging with the public. But likewise, we want to make sure that restorative practices are available at the community level for use through any of our community partners. Consider faith groups, consider youth serving organizations, consider community serving organizations. If we're working with the public, restorative practices might be an opportunity for us to be at peace with. Ready again about the eligible um, respondents, but again, 501c3 organization operating in the city of Chicago in good standing, and that you would be able to demonstrate your capacity to manage this kind of award in terms of your staff, your understanding of these strategies, your infrastructure as an organization, and your capacity to stand up quality reporting around your data and the utilization of that data to improve your own practices. The last program I'll talk about is our Mental Health Services and Prevention Education Award for Childhood Sexual Assault Victimization. Our interest is to really interrupt and prevent childhood sexual assault wherever possible. And we're seeking a delegate agency that has citywide reach, that has the capacity to provide evidence-based, trauma-informed mental health services to young victims of childhood sexual assault and their caregivers and parents. The provider should also support prevention education in high-need communities by expanding community and professional development on childhood sexual assault as well as child abuse and neglect. The goals for this program would be to expand clinical services citywide to children and adolescent victims, as well as their family members. So we're thinking we would be looking to, and what does that look like? That's individual therapy, that's family therapy, that's group therapy. We're talking about clinical interventions. We're also talking about coping skills management, and so what are case management concerns? So really expanding the clinical infrastructure available to victims. We also want to reduce service delays that are already well established for non-English speaking families, Spanish speaking explicitly, and we're looking for any of the applicants to ensure that at least uh, two of the three therapists that are going to be funded through this award would be able to conduct therapy in Spanish. And then lastly, that they would be able to increase childhood sexual assault prevention education. And so we would be looking for an organization that can demonstrate that they are competent in offering a well-established or evidence-informed or evidence-based curricula around prevention. Again, we're looking for a single organization, so that award level is 300,000. The organization then should prepare a budget that meets that award level. They should include their plan to hire clinically prepared staff to offer brief interventions to both youth victims and their families. We talked already about the different treatment modalities, individual, family, and group, as well as case management and other supportive services. Mental health therapies proposed as a part of this program should be currently practiced with demonstrated success with the respondent agency and include best practices and empirically validated practices where possible. And loosely translated, this means this would be this would be an award for an organization that is deeply rooted in these services already and not an organization, for example, that's interested in moving into that space but has not yet begun to offer those particular services or are not providing those services to youth victims and their families. As we've mentioned before, the same 501c3 organization would be the eligible type of organization to receive this award. They would be practicing, doing some business in the city of Chicago. They should be in good standing with the city of Chicago and demonstrate the organizational various capacities we've spoken about already. And that concludes my presentation. I think we may have time for questions and answers, but I'll take direction from the OBM team.
Yeah, no, there are a handful of questions in the chat if you want to start with those for folks.
That'll be great. Let me see if I can.
I'll jump in with you, Marlita. So there was one first question I saw. Can we get the HOPWA presentation slides? I'm sure that is, we can do that. Scott Witherspoon wrote, can you discuss grant dollar? Looks like that slide was skipped. If that's pertaining to HOPWA, I think timing-wise, that might have been about my presentation. So we're going to be making roughly $12.5 million available for HOPWA programming across facility-based housing, tenant-based rental assistance, short-term rental, mortgage, utility assistance, supportive services, and housing information services. Those will be distributed across all of those programs. The exact dollar amount is still to be determined. We have not received our formal notice of award for this period, which is not unusual. But that's the amount we're budgeting for it. And the idea is that we're going to be distributing those dollars across tenant-based rental assistance and housing-based or facility-based housing assistance based on the quality of the applications that come through. So at this point, we're not limiting the number of awards that would be made in any service category. We really want to see what comes in terms of quality of applications and how we can best support those applications to provide the services across the entire eligible metropolitan statistical area. So the dollar value of award is going to range based on the capacity of the organization that's providing the quality application. So for example, if an organization is, we do this really well, and we're in a particular community area and we have 5 beds, well, okay, we will support them with enough money to support the 5 beds. Another comes in and says we have 6 different buildings that we own and we operate that will each be 100% dedicated to HOPWA, they'll get a different amount.
And Marlita, will you go over the slide you had with the costs?
Sure. For actually, is the question for all of our programs, or for a particular program? I can
Unclear.
actually, let me just talk about, I'll reference all of them. For the bullying prevention program, that's a single award. The funding level is 100,000. For the restorative practice, the award count is 2, so we're looking for 2. We will make 2 awards at 200,000 per award. And for the child sexual assault, we will make 1 award, and the award level is 300,000.
The next question in the chat is, what VP bullying prevention programs exist now? What are their names and what side of the city are they located?
Great. And I think I see that there was a response.
Rick did respond to that one. So
Okay.
next one, for the most recent RFP, are the high need communities for prevention defined? Are there chosen neighborhoods or that must be targeted by prevention?
Okay. For the mental health services and prevention education for childhood sexual assault victimization, we are really looking for the applicant organization to demonstrate their ability, 1, to provide prevention education. What curriculum will you use? How will you provide that education, virtual and in person? So you would really talk about your capacity to provide those services, and that you'd have the flexibility to offer those services across the city based upon need. So as in your application, you should present the data, because we're looking for partners who are utilizing citywide data to be able to adapt and offer those services across the city. And so that would be something that as an applicant, you would provide that dexterity and speak about that in your application.
The next question is, can you provide a couple of examples of restorative resolution practices?
Yes, so RP practices really extend, so they extend across multiple deliberate dialogue strategies. Oftentimes you might see restorative practices happening in the aftermath of an event. So it could be in the form of a crisis debriefing. It might be in the form of a discussion. So you may have a peace circle, for example, in a community where the groups are new to one another. They have not been in conversation with one another. And so you may hold an actual deliberate dialogue, a circle with groups who might not be in active conflict, but they are just not talking to one another, and the absence of engagement is an issue. You may also do a crisis debriefing or mediation between groups that are actively in conflict with one another, where the goal is to arrive at a peace agreement, for example.
Thank you. Next question is, how many awardees for bullying prevention?
We intend to make a single award, and again, that award level is 100,000.
Next question, how do you get these clients? That's Eddie. If you want to clarify, go ahead, Marlita.
The clients you will be servicing in the community, how do you assemble them? How do you get them? Or do you go to the school, or how do you assemble them to provide the services to them? Or you guys have them already, then you have to provide services to you people.
Eddie, are you asking about a particular program?
All this bullying prevention and assault and stuff like that.
Okay.
How do you know them in the society, or how do you assemble them?
I think you raised a good question, and your question, if you don't mind if I leverage your question, that this is a part of the reason that we are looking for organizations that can demonstrate that they understand that work in that space, because being able to access the individuals who need that support is key. So that's a very important question. For example, if you are submitting an application for the child sexual assault program and you're a provider, but you're not really familiar with child sexual assault, you're not familiar with the hospitals where those young people are assessed, you're not familiar with the networks where other providers are serving young people, you don't know how to connect to those case management resources, it would be very difficult, and the city then would essentially have to coach an organization to stand that whole program up. And we are instead looking for organizations that understand that space and that are already working within that space. And so those groups would know how to engage those systems where victims are being directed to get those, kind of technical issues addressed in terms of doing police reports, um, engaging with medical care if there are those physical injuries, making sure that post-police reports that they then get um, connected to providers who stand up and engage them over time with these helping resources. So that's really, I think, in response to the child sexual assault particular program, but I believe you also mentioned bullying. So across the city, our programs are looking for ways to engage with the school systems, our park districts, our libraries, places where individuals reach out for assistance. We're looking across our police departments. So we do have many social systems that are available for individuals who are reaching out for care. But our bullying prevention program really is not designed to find particular one or two particular clients, but we really are talking about how do you come online with Cdph as a delegate to help us rebuild and to expand a system um, of partners who are working in the same space and to elevate using online resources and other kinds of promotional strategies so that we're not finding a particular client, but instead we're advertising the opportunity for services so that clients know how to raise their hand and reach out for support.
Thank you. Next question. For prevention programs, could you clarify how the city's funding will be allocated toward incentives such as refreshments, gift card checks for individuals?
I think that's a difficult question. I don't know that we go into lots of detail about that in the RFP, but depending on the program, I think when we get to the, let me see, let me think about that. That's a difficult question. Let me reboot my response. Depending on the program, if there are allowances for incentives, then I think our team members are able to coach the respondents in terms of what the allowances are. But not all of our programs allow for incentives. Not all of our programs allow for stipends. And so it really does depend on the particular program.
Thank you. And then the last question in the chat is, what is the deadline for VPI restorative practices?
So our programs will close on schedule with all of the programs that are a part of this release. And so our programs release on April 1st and our RFPs will close on June 2nd. And if we have just a few minutes, I would like to offer just a little feedback that I think is helpful for applicants. I did hear other agencies offering that, and I think that's a great idea. So I would just say a couple of tips. We do like to remind applicants that they should anticipate that our evaluators for our awards are not necessarily experts in your particular field. And so they understand the awards, they are trained on the RFP, and they're trained to use the scoring rubric that is in the advertised solicitation. However, you should not expect that they would as an evaluator, they would know your work, that they're going to look online and investigate your organization. So if there's anything about your program that you think is important, that makes your application strong, we encourage you to put all of that in those applications. Also, if there is one question that you've answered really fully, but then another question that you feel like I answered a little bit of that in the previous question. Please answer every question fully and don't anticipate that the evaluators will leverage what you said in question 1 to answer question 3. So just make sure each of your answers include all of the details that really allow you to maximize all of the points you want as your application is scored. And lastly, please do be mindful if we're asking about capacity and whether it's organizational or programmatic or fiscal, please be explicit about your staff capacity and your organizational capacity. So again, our evaluators will not go and look online to see how long your organization has been operating or how long you've been carrying out a particular intervention. We really rely on you all as applicants to give us everything we need to fully understand your response.
Another question from the chat. What is the average length of time to be reimbursed?
I would say, and Patrick, you may have a different response. I think
Yep.
that when we're looking at the front end of our programs, that it might be 60 days, sometimes not 90 days. That is not the goal. But we may have lag time at the beginning. After that, pretty much we do get into a routine of submitting invoices because they go in, our invoices are in iSupplier in the same way that organizations are able to look for other awards outside of the CDBG awards. You can look in iSupplier. We receive our invoices and vouchers in iSupplier. We make payments through that same system, and you're able to track your payments in iSupplier.
Yeah,
Patrick,
just
do you
that.
have a different response?
More just like an adding to it. So that initial reimbursement, that first reimbursement can't be conducted until the contract is fully executed, so, which can take a period of time, as Marlita alluded to, like it can be a couple of months. Once that contract is executed and those first invoices, those first vouchers are processed, provided there aren't any glaring errors or things that need to be corrected or non-allowable costs that are associated or included in the invoices, processing and reimbursement of invoices can be done in a matter of a couple of weeks. The primary reason we see delays is it's often when there are errors or inconsistencies in the invoices or in the event that an organization needs to do a budget revision. Budget revisions take 6 to 8 weeks to process, and during that time, you can't submit an invoice. So it all depends, but the average like if everything goes fine, processing time for an invoice, not at the start of a contract, would be a couple of weeks.
Next question in the chat, is all funding only available via reimbursement, or do you offer capital advances?
I will say our programs are reimbursement based.
Same.
And I'm just going to flag that we have 5 minutes here left with CDPH. So if you have any other questions, please feel free to raise your hand if you'd like to ask them out loud, or go ahead and put them in the chat while we still have CDPH with us until 11:30.
Hi, Marilyn. I see your note in the chat that there are lots of killings in Rogers Park, and that you hope there are resources allotted for this area too. And I will say that we've talked about today are 3 of our programs, but our office offers other violence prevention and safety focused programs. And so please do consider um, making sure your organization is signed into iSupplier, that you have a profile there, and that you are following Cdph so that you will see other award opportunities that we offer beyond our CDBG programs.
So there's a question from Guarang. Are there programs associated with grant funding? I'm assuming, like, are these programs associated with grant funding? The HOPWA, Housing Opportunities for Persons with HIV, are funded through Housing and Urban Development at the federal level. So the funding comes down to the Office of Budget Management, which then directs the Housing Opportunities for Persons with HIV/AIDS funding to the Chicago Department of Public Health.
And if it's helpful, as soon as when I can type, I'll drop in the chat the Cdph RFP page so that you're able to, on that page, you can sign up with your email address so that you can get announcements when Cdph has other grant programs that are out and available for application. And not just violence prevention, but across the department. Those are the same programs that are located in iSupplier, but it's just another way to make sure you are aware of emerging opportunities. Hi, I'm sure I'm going to say this wrong. Tules. Thank you for your note. I see in the chat you mentioned what tab in iSupplier. Um, so once you're on the iSupplier page, and I think probably our OBM friends might have more information there, but you would be able to see all of the bid and solicitation opportunities across the city. What we've put in the chat is also a shortcut for Cdph grant opportunities because it's just a landing page, but even our landing page directs you back to iSupplier. So iSupplier is really the centerpiece for the city's grant opportunities the majority of the time.
And yes, we will be going over how to look up all of the solicitations and things like that in the next section for the iSupplier workshop, which will be starting at 11:35.
You share the schedule for the remainder of the day. I think that's for OBM. So what I'll say in our last 30 seconds is thank you all so much for listening to both Patrick and I and the Cdph opportunities, and good luck with your grant making.